So, Dr. Likanau, thanks again really for talking to us. So, we discussed really about really the lack really of expertise, the lack really of ophthalmologists, particularly in the surgical section. So, can you tell us more about it, and what role do you think really the diaspora can play?
It's a good question. As Africa as well as Ethiopia, there is lack of trained human resource. And what the diaspora can do is that there are many ways to be involved. One is to come and pass some time with the Ethiopian doctors and other health professionals and train them so that they will be better equipped with modern science. Therefore, one is capacity building. Coming for a week or two and giving hands-on training with some lectures, then practical things together will be very helpful, because we have learned that a lot of well-educated people are in the western part of the globe. They are established there, but if they can come and train others who can be also a trainer, who can be trainers in the future, that would be very helpful. In terms of ophthalmology, it is the same, there are some areas, where we send still patients abroad. Therefore, with the local capacity building, it will be very helpful if they can train. And then after the training, if they can bring some equipment also with them, so that after the training, those people can practice what they are already been trained. Therefore, they can train and then, support with some equipment as well as supplies, so that the system will be strong enough to sustain itself. The other thing is, even giving service, specialized service for a week or two is also important. If they can come and serve, the poor community in the different localities of the country, that will be very helpful. If that can be arranged and they commit themselves to give their time for that. And then, in the future, for example, now we are shifting a bit also from small incision to phaco surgeries. In the Western world, they are doing, it is phaco surgery for cataract also. Therefore, even though we know it is expensive a bit in terms of equipment and so on, but the skills can be transferred, and if they can get, equipment also, people can do phaco surgeries. It is being done in some institutions, especially in training institutions, but not everywhere. Even at the level of secondary eye care units, if they can do, these mixed procedures, one is the small incisions, the other option might be phaco training. Then, some people might want to get a phaco surgery and pay more. Therefore, that the rich subsiding the poor principle can help to develop the system so that it will be self-sustained, with a type of payment system. They can pay. The surgery might be the same, but sometimes, if they can get, a better condition to stay during the surgery or so on.
What is, so for somebody, sorry to interrupt, for somebody that's interested in being part of this journey, what are the mechanics? How, I saw and I met really today two bright ophthalmologists one from Atlanta and the other one from Stanford University, one from Sudan and the other one from Kenya. So for an Ethiopian that's really abroad, or any African that's really abroad and want really to be part of this journey, what are the mechanics? How do they get in touch with you or any other institution?
Yeah, there might be different mechanisms. Like, NGOs can be one source or contact as stakeholders. The main one is Ministry of Health, through Ministry of Health that can be coordinated because NGOs also work under the Ministry of Health. The other thing is through societies, like here in Ethiopia, like Ophthalmological Society of Ethiopia. These are professional